Hi, so today I'm going to show everybody my most favorite procedure in the world, the Silhouette Instalift, which I feel is a facelift without the facelift. So marking the patient is very important because you want to find the points of maximum lift. So it's very artistic, every patient is different, and it's very important to find out where to pull from to get the optimal results. Patient up again. So the most uncomfortable part of this procedure is the actual numbing of the little entry points. This is where the needle goes in, and this one and the one up here are the exit points. So that can be a little uncomfortable if those dots are not numbed up. So what I'm doing here is numbing up those points with lidocaine, and it burns a little bit just like at the dentist until it kicks in. How's it going? This is a sterile procedure, so I'm gloving up here with sterile gloves and further proceed. Turn your head to the side, please. Hold it on the side. Can I wipe her off a little bit? Yeah, that's good. So this procedure, the worst thing that can really happen with this is bruising. However, there's several ways that I manage bruising and actually decrease it quite a bit. Number one, the lidocaine that's being used to numb those little entry and exit points has epinephrine in it. Epinephrine is a vasoconstrictor. It constricts the blood vessels, so thereby cuts down on bruising. The second way I try to minimize bruising is I use this little vein finder that shows me all the major blood vessels under the skin, so I know how to avoid piercing those blood vessels with my needle. So here's the thread with the little cones and a needle on each end. We have to pull this to make sure all the nuts and cones are in place. Now, as you can see, by numbing those entry and exit points, the patient is quite comfortable through this procedure. It's not painful at all. Usually they feel the pulling and tugging, but not pain. So now I'm doing the neck. So the last step is to further pull the threads as tight as possible. If patients are not warned, they tend to get a little scared afterwards when they see how tight they look. But this is actually an essential part to having a great outcome. Once I pull as tight as I can, I ever so gently press on the skin, which opens up the little sculpture cones to anchor under the skin. It's a really ingenious mechanism because this way I don't need to suture anything. I just cut off the threads. The results of this we see at the earliest 3 months later, and it takes up to 6 months to stimulate collagen. Collagen stimulation occurs through two things: the actual sutures that dissolve within 4 to 6 months, and also the little sculpture cones stimulate overall collagen production. And because of that, as a side effect that comes with this procedure, patients notice a much better skin tone and texture. Cleaned up and receives the post-op instructions. The main thing is not to do anything strenuous for about 2 weeks. That would snap these little threads, like biting into a large apple, swinging your neck vigorously, that type of thing. So this is what the patient looks like immediately after. If you look from the side, pretty pulled, but nothing terribly horrible looking. I don't really see any bruising at all. So this tightness will all relax within the next 2, at the most 3 days. The only blue spot is here, but that's not even a bruise, that's from my blue marker. So basically, this is it. Not much downtime at all.